Nearly 500,000 new COVID-19 cases were recorded in the U.S. Wednesday. That number from the CDC is the highest single-day tally since the start of the pandemic. Health officials say getting vaccinated and receiving a booster shot remain the best protection against the highly contagious Omicron variant. As cases continue to climb heading into the new year, the FDA is reportedly close to expanding Pfizer's booster shot eligibility to younger teens and adolescents. Meantime, New Year's Eve celebrations across the country are being scaled back or canceled altogether in response to the virus's rapid spread. CBS's Nancy Chen has all the latest developments from New York City.
It was another record-breaking day here in New York, with nearly 75,000 new cases reported statewide. Hospitalizations are also rising fast here, as more than 1,000 hospitals across the country now say they have a critical staffing shortage.
With final preps underway for the New Year's Eve ball drop in Times Square, COVID cases keep rising to record highs. To fight the surge, incoming New York City Mayor Eric Adams said he'll keep in place a first-in-the-country vaccine mandate for private sector workers.
Our focus is vaccine and testing, vaccine and testing, vaccine and testing.
City services are feeling the strain. Several subway lines have suspended operations because of staffing shortages. The fire department says 30% of its EMS personnel is out sick, and 21% of NYPD officers are out too. In Cincinnati, the mayor declared a state of emergency after more than 24 firefighters came down with COVID, with those remaining forced to work overtime.
Nobody can recall a time in recent history within the last almost 50 years where firefighters have been forced to stay beyond their normal hours.
Nationwide, COVID cases are rising so fast, it's estimated more than 3 Americans are testing positive every second. 15 states, plus D.C. and Puerto Rico, are averaging more daily cases than ever. Florida shattered its state record that was set just yesterday.
Where are we right now in Omicron's surge nationally?
We are at the very beginning, unfortunately, and likely have at least 4 to 8 weeks before we're going to see it rise and then begin to fall again. And during that time, we are going to see COVID activity in this country like we haven't seen since the beginning of the pandemic.
And as pediatric hospitalizations hit a record high for the year, the FDA is reportedly expected to authorize Pfizer boosters for 12 to 15-year-olds early next week and boosters for children 5 to 11 with compromised immunity. Johnson & Johnson released data showing its booster is effective at reducing hospitalizations against the Omicron variant. Still, no matter their vaccination status, travelers are now being urged to avoid cruises, and new guidance out today from the CDC. More than 5,000 new COVID cases on cruise ships were reported in the last 2 weeks. Omicron's surge has continued to strand those traveling by air. More than 1,000 flights have been canceled today.
We're not going to live forever in a constant crisis, but for the time being, it's going to be a challenge.
Another tool in the fight against COVID is soon on its way. The first of the pills authorized for at-home treatment is expected to go out this week. Elise?
Nancy Chen, thank you. For more on this, we want to bring in Dr. Payal Patel. She is an infectious disease physician at the University of Michigan Medical School. Dr. Patel, thank you so much for joining us. I want to start with news that the FDA is expected to authorize Pfizer's booster for 12 to 15-year-olds. How important is a third dose for this age group?
Yeah, it's a great question. You know, right now, about half of that age group is vaccinated at all. So that's concerning. Half of those kids haven't gotten a first dose or a second dose. That's really the group that we need to focus in on. And that would be the group that I would really hope parents can hear this news and start getting those first and second doses in. I do think it's good news that they're going to be approved for a booster. And really the part that I'm very optimistic about is that age group of 5 to 11 who have immune deficiencies getting that booster, because we're really trying to protect the highest risk of those kids from being hospitalized or having to come into the hospital.
Speaking of, according to the Department of Health and Human Services, child hospitalizations have nearly doubled in some states. Is Omicron worse for younger patients in terms of severity of symptoms?
at this point, despite us having vaccinations for kids over 5, there remains a huge population of kids who just haven't been vaccinated. And so when you look at the nation and who's been vaccinated and who hasn't been vaccinated, there's just a lot more kids that have been unvaccinated. That's how I would think of it. We don't have evidence yet that Omicron is worse in kids, but I would say I would look at this news and talk to your niece, talk to your nephew, talk to your sister, talk to the kids about getting vaccinated. That's going to be the best way to protect them going into the new year.
So as a parent, if you have a child vaccinated or unvaccinated, when do you advise that you take your child to the hospital if their symptoms are just that severe?
I will say, working right now in the hospital, in the ER, inpatient, it is really chaotic, really busy there. So, a good reason to go to the hospital would be anything like trouble breathing. That would really be concerning for any age. Now, if you're going to the hospital or the ER to get a test, or, something like, you're feeling okay, but you're not sure if you were at a recent birthday party, you may have been exposed. Those are not good reasons right now to come to the ER. And I know here in Michigan, we've actually had to tell the public, listen, our ERs are pretty full. Please don't come just for something like getting tested. So I would say right now, it would be those concerning symptoms that would bring you to the ER.
Can't even imagine having a child that sick. So a new study out of South Africa found a second dose of Johnson & Johnson's COVID vaccine reduced the risk of Omicron hospitalizations by 85%. The CDC recently endorsed Pfizer's and Moderna's boosters over Johnson & Johnson's because of concerns of a rare blood clotting issue. Do you think this will ease fears people may have with Johnson & Johnson shot?
Yeah, and I think this is good news. We are kind of waiting for more data that's going to come out with the new Omicron variant. And this is the latest study in healthcare workers. So these are folks who are going in, working every day, possibly working with COVID patients, possibly being exposed to COVID at home as well. So it's really a real world study, and it's really up to date. I think this is good news for folks who got the first Johnson & Johnson and are thinking about getting a second. We'll have to wait for the final data to come out, but I do take this as hopeful news.
How long do you think it will be before we start to see new infections involving the Omicron variant level off and eventually decline?
Yeah, I do think that it's going to be at least through January that we're going to be seeing what we're seeing now. I think we're only in the early part of the wave. I would remind people, though, that we're in a very different way than we were 2 years ago, when we didn't have a vaccine. And so many people that we knew, if they got infected, were going to end up in the hospital, were going to end up either having a horrible time with the infection or dying. Now, if we think about folks who are vaccinated, ourselves, our family, they're often having a mild infection. And I would say that is really good news, showing that the vaccines do work.
We are definitely in a different state. Speaking of, a lot of people are getting ready to celebrate New Year's Eve Friday. What is your advice to those who plan on attending larger indoor gatherings where the vaccination status of everyone may be unknown?
Oh, man, I would say if you're a risk-averse personality, right, this is not the time to play, a battle of risks. You yourself might be honest about taking a test and it being positive or negative, but can you say that for the thousands of other people that are out? So I would really think again, are you someone who potentially could get very sick? Are you older? Do you have any immune deficiencies? Are you unvaccinated? I would take a gut check before you do something this New Year's Eve to ensure that you have many more times in the future that you can get together with those that you love.
Definitely good advice and something to think about. Dr. Payal Patel, thank you.
Thank you.